So this is part of the lecture series of maturing versus aging, and this is on cardiotoxins, part of the cardiovascular disease. This will not be the only lecture on this because there's so much information. But I wanted to cover some things. Basically, that's why instead of just cardiovascular, it's more designed for cardiotoxins. So let's start that. So cardiotoxins can be in your medicine cabinet, your doctor's office, and often on your dinner plate. Illegal drugs, prescription drugs, even certain cancer treatments can be very toxic to your heart immediately or cause it to fail over time. Toxins means poisonous. The cardiotoxins listed, and what I'm going to do is go through these, weaken the heart muscle or damage the heart's sensitive electrical system. Although the damage is sometimes reversible, if caught in time, a serious exposure with a heart toxin can also be fatal. The 9 following toxins are an example of the importance of knowing about this information. The first ones will not apply to most, but to too many people. So the first one of these 9, number 1, cocaine in your heart. Cocaine can be profoundly toxic to your heart, both short and long term. Cocaine can cause elevated blood pressure and heart rate. It can actually result in damage to the heart muscle and potentially cause a heart attack or stroke. Chronic cocaine use can lead to a condition called dilated cardiomyopathy enlargement and weakening of the heart, which causes congestive heart failure. This can result in irreversible heart damage, shortness of breath, swelling, and risk of sudden cardiac death. In fact, according to the latest estimates, cocaine leads to about 422,000 U.S. emergency room visits a year. Many are heart-related. Number 2, ecstasy and heart rhythm. The popular illegal amphetamine, MDMA, also known as ecstasy or Molly, can interrupt the heart's normal contractions. MDMA's effect on the heart are similar to those of other amphetamines. It can induce arrhythmias and in some cases result in fatal heart arrhythmias and sudden cardiac death. In 2002, a CDC report on ecstasy overdoses, a New Year's Eve rave in Los Angeles found that people suffered seizures, tachycardia, and dangerously elevated heart rates on that drug. If you have any type of heart condition, you should stay away from stimulants like coffee, amphetamines, and any illegal drugs. Also avoid taking prescription drugs that were not prescribed to you. Some of these are no-brainers, but some people need to hear this. Number 3, ADHD medications and heart conditions. Prescription stimulants like methylphenidate treat ADD, ADHD, but in some cases of children with heart conditions, it's caused sudden death. Did I say sudden death? Yes. So there are many things with this. I'm just trying to make the point with these things according to studies and statistics. Commonly prescribed brands include Adderall, Ritalin, and Concerta. You know, the chemical compound of Ritalin, which they want to give to the kids all the time, is very similar to cocaine itself. Because of this, before you or your child begin treatment with a stimulant, be sure to let your doctor know about any heart symptoms, including chest pain, any irregular heart rhythm, high blood pressure, or recent heart attack or heart episode. Again, these seem like no-brainers, but it's too important to not cover. Number 4, chemotherapy and heart failure. You don't normally associate those two, but let's talk about that. For cancer survivors overall, heart disease is a leading cause of death. This is something very little known to most people. It's second only to the additional cancers that usually reoccur anywhere from 1 to 5 years. One of the reasons cancer survivors become vulnerable to heart disease is that certain chemotherapy drugs are very toxic to the heart. The most common cardiotoxicity is a condition known as left ventricular dysfunction or heart failure. Breast cancer patients sometimes undergo an echocardiogram, ultrasound, or heart scan before receiving chemo medications known to be cardiotoxic. Chemotherapy drugs, such as doxorubicin or drugs that target the human epidural growth factor receptor type 2, also known as HER2, can cause weakness of the heart muscle, and the weakness makes it harder for the heart to pump blood. It also causes symptoms like shortness of breath, and at rest, chest pain, swollen ankles or arms, and the sensation of rapid or irregular heartbeats. Some newer types of chemotherapy come with fewer heart side effects because they're finding the danger of the treatments that they're using are just impacting the heart too much. So fewer chemotherapy agents such as liposomal, doxorubicin, and the cardiotoxicity is reduced, but it's still there. Oncologists should collaborate closely with cardiologists in order to limit or reverse heart damage when you undergo chemotherapy. It's really up to you to get that to happen for you. Number 5, radiation for cancer treatment. High doses of radiation can damage the heart, leading to an increase in deaths from heart disease. For patients with breast cancer, for example, radiation that reaches the heart has become a special concern. Dr. Sharp, a radiation oncologist at the Levine Cancer Institute, stated that we cure more women of breast cancer and they live longer, that's what their claim is, so we've come to understand better about long-term toxicities of treatments that were delivered decades ago. So this is the kind of delay we're finding a lot of times, decades later. Although the toxic effects occur at the time of the treatment, but sometimes usually increase over time. Some doctors have more recently become aware about minimizing radiation to nearby normal tissues, like your heart. New methods include having patients hold a deep breath instead of breathing freely during radiation treatment, tracking their respiration and putting them in a prone position. In many cases of left-sided breast cancer, the heart can have decreased radiation dose. Number 6, radiation from CT scans and heart damage. Exposure to radiation from computed tomography or CT scans can also harm your heart. In the U.S., about 24% of personal radiation exposure comes from CT scans, estimates the National Council on Radiation Protection and Measurements. CT scans use multiple X-ray images, and each of these exposures to you increase your radiation toxicity. One X-ray involves about 0.1 millisieverts radiation exposure. A CT scan uses about 100 times more. In recent years, the trend is towards CT scans using lower doses to minimize risk of heart damage. Now, you understand the terminology here. They talk about minimize, it's decrease. You still get heart damage. You still have these problems. So number 7, erectile dysfunction, often called ED. So ED drugs and blood pressure. Certain prescription drugs can overburden the heart and be dangerous for people with heart conditions. These include treatments for ED or impotence. Cardiac patients who take nitrates should avoid drugs for ED such as Cialis and Viagra, the two flag wavers, I guess. The combination of Viagra and nitrate heart drugs like nitroglycerin and drugs like amyl nitrate or nitrate, and also these are known as poppers, can lead to a dangerous drop in blood pressure. Be sure to bring up any heart disease history or symptoms with your doctor when discussing possible ED medical treatments. There's there's a huge onslaught of problems with that. Number 9, mercury poisoning from fish. An environmental pollutant, mercury can be profoundly toxic to the heart. A study revealed that to humans is the second most toxic substance on the planet to humans. Mercury toxicity, aside from being a neurotoxin, can raise your blood pressure, cause arrhythmias, and increase your heart attack risk. The most common source of mercury poisoning is fish, especially tuna, which is the most consumed fish in the United States. To help avoid high doses of this toxin, don't eat fish that are known to be high in mercury, which means those containing 100 to 200 micrograms of mercury per 4 ounces of cooked fish. According to the US FDA, we know that FDA recommendations are too often lenient and out of date concerning toxic levels. So the fish highest in mercury include shark, swordfish, king mackerel, and tilefish from the Gulf of Mexico. By comparison, safer choices like salmon and sardines have 100 times less mercury in the same serving size. Tuna is now rated as an intermediate level of mercury, between 13 and 15 micrograms per 4 ounces of fish, due to the rise of mercury levels in other fish. So we're not talking about the levels of mercury in tuna are going down, it's the other ones are going up. Women and young children should avoid eating any fish in high mercury levels, says the FDA. Pregnant women should limit their fish consumption to 12 ounces per week overall. To help protect the most vulnerable, a developing fetus and growing child, Consumer Reports goes even further, advertising pregnant women should avoid tuna altogether and the other ones that are high in mercury. Play it safe. If you're worried about a medication you're taking or a treatment you need that may be toxic to your heart, check with your doctor and get the facts. You can also always check with your pharmacist as well. Sometimes you'll get additional or different information. Environmental toxins that can affect your heart and overall health. Though distasteful to think about, we live in an increasing sea of chemicals that have a very sufficient impact on our health, our endocrine disorders, and chronic inflammation. These are just two of the conditions influenced by the unnatural particles, and even some natural ones, in the air we breathe, the food we eat, beverages we drink, and products we use on a regular basis. Although we lack the individual ability to eliminate toxins from the environment or to monitor them the way we'd like to in our daily lives, it is within our control to minimize or avoid exposure to the best of our ability. So that's our job. We don't get into fear. We eliminate what we can and we minimize the rest. And you do what we're learning, because the toxic state of everything has greatly changed. So we're learning new methods to help the body detox. So you want to continue this. Detox your body and avoid these toxins. Number 1, insecticides and pesticides. They're a major contributor of Parkinson's disease. I'd like to go further into that. Maybe we can do that on another one, because we're going to have another lecture on brain health. The first one just wasn't enough. So number 2, pharmaceutical drugs deplete the body of nutrients and energy. For example, statins deplete coenzyme Q10, and diuretics deplete precious potassium and magnesium. If you feel you need medications and want to supplement them, you want to supplement them accordingly. Number 3, alcohol. Overindulgence ages the body and greatly dilutes your antioxidants. Number 4, high fructose corn syrup. It's added to thousands of processed items, processed foods, and even your supplements. And it's particularly prominent in soft drinks, fruit drinks, and much more. It promotes inflammation, obesity, and liver dysfunction. Number 5, mold. It grows in dark, damp places and can cause severe allergic reactions. I'd say from what we're seeing, there's at least an epidemic across because it's not only the local people here, but we get people from different parts of the U.S. One of the other things we're finding is a lot of people are breaking out in unusual, unknown rashes that seem to get severe, spread in the body, and I find that this is happening in different parts of the country, not just like east side, west side, or north or south, but all over. And I don't have an answer for why, but when we test, we're coming up with extreme levels of fungus and mold. There is no one without some level of fungus and mold. Most are actually infested. Many illnesses and diseases are fungal based. Even many cancers are fungal. Some are viral, and it is vital for your cardiovascular system to be free from accumulating sticky and dangerous fungus. Number 6, cigarettes. Each puff contains thousands of compounds you don't want in your body. In order to detoxify your body, you want to stop smoking. Number 7, soft drinks. These drinks contain way too much sugar or artificial sweeteners that can cause inflammation, plus phosphoric acid that leaches calcium out of your bones. Consider sugar as a poison, not the artificial sweeteners, because they're worse than poison. Number 8, trans fats. These unnatural fats have been removed from many foods compared to a couple of decades ago, but you still need to look out for them on labels, back of labels, because trans fats promote inflammation and oxidative stress in the body. Avoid consuming or cooking with anything containing fats that are hydrogenated in order to detoxify your body. In other words, avoid these so that you can detox. You don't want to be doing things to detox your body and doing something else that's going to work against it. Plus, heating any oils over the average of 212 degrees changes the chemical composition and becomes toxic to your body. So if you're thinking any of the fad oils or the promoted cooking oils, there are some that handle heat differently. That's for taste and cooking. But if you go over 212 degrees, you change it chemically. Number 9, chlorine. Although this chemical is used to disinfect most public water supplies and pools, it reacts with naturally occurring elements in water to form toxins. Toxins called trihalomethanes, which has been linked with asthma, cancer, and heart disease. Chlorine has also been shown to interfere with thyroid function, a serious pandemic in the U.S. So limit your time in chlorinated pools or spas, as chlorine is absorbed through the skin highly, and shower immediately after exposure, but preferably avoid it altogether and definitely don't drink it. If your tap water tastes bad, likely from too much chlorine, then use spring water in glass. You can do spring water in bottles, but it's still going to be toxic. Number 10, perfumes, cosmetics, and aluminum-containing deodorants and antiperspirants. Perfumes and cosmetics contain all kinds of chemicals that are absorbed in the body. Most you just should stay away from. They do have an increasing amount of more natural ones. So use essential oils instead of perfumes, and make sure your cosmetics are made with natural and organic ingredients. The aluminum in deodorants, especially antiperspirants, I don't know of any antiperspirants that don't have it, may cause inflammation in the armpits and contribute to breast cancer and brain damage. Number 11, xenoestrogens. Xenoestrogens, these are man-made chemicals which are made in many common everyday products and have estrogenic properties and can affect sex hormone activity. They may also increase the risk of hormone-sensitive cancers, especially breast, uterine, and prostate. Common sources of xenoestrogens include pesticides, herbicides, fertilizers, polycarbonate plastic bottles, including those you used for drinking water, and food containers. Some say do not microwave any food with wrapping or containers made with plastic. But what's best, don't microwave at all. Nothing, not even water to drink. Number 12. Processed meats such as bologna, ham, and especially hot dogs, they contain nitrates, which in addition to being preservatives, are toxic to the GI tract and contribute to the formation of cancer. Avoid these nitrate-laden meats. Basically, if they don't tell you that it doesn't have nitrates, it has nitrates. Number 13, heavy metals such as mercury and lead. I mentioned tilefish and shark and tuna before, and swordfish have the highest mercury content, so limit your fish consumption to smaller species such as Atlantic halibut, Spanish mackerel, scrod, and wild salmon. Latest reports say avoid freshwater fish altogether. Although limit your consumption of farm-raised fish, it tends to have a higher mercury level content than wild-caught fish. And this really all depends on regions. This, of course, depends on the fish and the region and what they are fed. Number 14, radon. This odorless, invisible gas seeps from the ground into houses through cracks and foundations, and it poses a real health danger. Radon toxicity is the second leading cause of lung cancer after smoking. That's pretty serious. And I find a lot of people that don't have a radon detector in their house. You need to keep it, and actually, the fire department will tell you that you need to change that out once a year. It's odorless, tasteless, and can take you out before you even know that it's there. If you don't have a radon alarm, you have no idea. You just go away. Example, 1 out of 15 homes in the country may have elevated radon levels, according to the U.S. Environmental Protection Agency. So, to detoxify your body and test your home for radon, get a radon detector at your local hardware. They're very easy to find. Listen to this statement from the American Heart Association. You may know that heart failure is a condition in which the heart can't pump enough blood to meet the body's needs, but did you know that certain dietary supplements and over-the-counter drugs may actually cause heart failure? The American Heart Association published an article in August 2016 in their publication Circulation. It highlights some of these drugs and supplements that are commonly used, many of which you can get without a prescription. You may be thinking that if these medications and supplements are too risky for use, why would they be easily available to the public? But they are available. Here's how they can harm your heart, says the article. Now I'll read it, then I'll explain the one-sided spin they have on this for each one. So non-steroidal anti-inflammatory drugs, NSAIDs, NSAID.
Like aspirin and Tylenol and all that.
Exactly. So NSAIDs, including ibuprofen, naproxen, can increase heart failure risk. NSAIDs can increase salt and fluid retention, lower your body's response to diuretics that help eliminate fluids, and increase your blood vessel vascular resistance, which makes your heart work harder. Products containing ephedra, which is ma huang, another way of saying that, such as traditional Chinese herbal remedies and herbal teas can increase heart rate, blood pressure, and the heart's overall workload. In a weakened heart, these products can also result in life-threatening, abnormal heart rhythms. This is true in sensitive situations, especially true in cases with medication. So let's investigate that statement. Let's look at this for a moment. Example, quote, Dashan, garlic, ginkgo, motherwort, saw palmetto, hawthorn, and licorice are complementary and alternative medicines that can impair blood platelet function. These medications, notice how they're called medications, they're natural medications, can also raise the risk of severe bleeding in people with heart disease who take anticoagulant, blood thinning, or antiplatelet drugs, but not in those who do not take pharmaceutical drugs. So that's the catch. You got to read between these. That's the spin they put on it. So examples of blood thinners are Coumadin and Jantoven, which is also known as Warfarin. Pradaxia, Xarelto, Eliquis, and I'll call it Savasa. The Texas way to pronounce that is Savasa. Hang in there with me. Where do they get these names? So let's look at it. Warfarin side effects that require immediate medical attention. This was not in their article. So this is the flip side of the coin. This is when you're taking the drug that they're comparing it with, when you're taking something that relates naturally. Let's just look at the drug by itself that requires immediate medical attention that has side effects. Severe bleeding, including heavier than normal menstrual bleeding, red or brown urine, black or bloody stool, severe headache or stomach pain, joint pain, discomfort or swelling, especially after an injury. Oh, that sounds wonderful. When you take warfarin, your blood won't clot easily. If you accidentally cut yourself while taking warfarin, you may bleed heavily. There are cases that they have very difficult time stopping it. Not that you'll just bleed heavy, but difficult time stopping it. I know one case they went to emergency room and they were using cautery and still having a difficulty stopping it. And that's usually what stops it. Boom. At times you may need medical attention to stop the bleeding, rarely, but warfarin can cause the death of skin tissue, necrosis. This complication occurs most often 3 to 8 hours after you start taking warfarin. If you notice any sores, changes in the skin color or temperature, or severe pain in your skin, seek immediate medical care. That's the disclaimer statement. There are less serious and more common warfarin side effects. Let's look at those. Bleeding between menstrual periods. That's not cool. Diarrhea, vomiting or inability to eat for more than 24 hours. Fever. Drugs and supplements can interact with warfarin. Like any other pharmaceutical medication, warfarin can interact with foods, other drugs, vitamins, or herbal supplements. The interaction might lower the effectiveness of warfarin or increase your risk of bleeding. More than 100 drugs and foods have been found that can interact with warfarin have been identified. Drugs that can interact with warfarin include many antibiotics, antifungal medications, such as diflucan, aspirin or aspirin-containing products, ibuprofen, Advil, Motrin, and others, or naproxen, sodium, Aleve, and Anaprox. Like in Tylenol and others, there's many things, cold and allergy medications, medications that treat abnormal heart rhythms, antacids or laxatives. Foods and drinks that might interact with warfarin include cranberries or cranberry juice, alcohol that are high in vitamin K, such as soybean, canola oil, spinach, and broccoli, garlic, black licorice. So your doctor might recommend keeping the level of vitamin K in your diet consistent rather than avoiding vitamin K-rich foods altogether. So the issue is with the medication and the risk it creates, not the foods and natural supplements alone. They do not produce these side effects. Although there are precautions with certain diseases in which particular foods and natural supplements should have professional supervision, but by themselves do not have such negative and dangerous side effects as synthetic pharmaceutical drugs. Another example, Pradaxa. Common side effects: acid or sour stomach, belching, black or tarry stools, bloody stools, constipation, heartburn, indigestion, pain or burning in the throat, stomach, discomfort, upset, burning or pain. Vomiting of blood or material that looks like coffee grounds, that's not good. Less common side effects: cough, difficulty with swallowing, dizziness, fainting or loss of consciousness. Fast heartbeat, fast or irregular breathing, puffiness or swelling of the eyelids or around the eyes, face, lips, or tongue, redness of the skin, skin rash, hives, welts or itching skin, tightness in chest, trouble breathing, unusual tiredness or weakness, large hive-like swelling on the face, eyelids, lips, tongue, throat, hands, legs, feet, or sex organs. This is not good. Other side effects not listed may also occur in some patients. If you notice any other side effects, check with your healthcare professional, because they're just not listing all that they can, and they're always finding more. Xarelto. Let's take a little further look. We're only looking at about 3 of these. So Xarelto, Mayo Clinic lists the following as some of the more common side effects, like uncontrolled bleeding, back pain, bleeding gums, bloody stools, bowel or bladder dysfunction, burning, crawling, itching, numbness, prickly pins and needles, or tingling feelings over the surface of the skin, coughing up blood, difficulty with breathing or swallowing, dizziness, heartache. I don't mean you broke up with somebody. I meant to say headache, increased menstrual flow or vaginal bleeding, leg weakness, nosebleeds, numbness, paralysis, red or dark brown urine, vomiting of blood or material that looks like coffee grounds. That keeps coming up, doesn't it? No pun intended. Not everyone who takes Xarelto experiences the above-mentioned side effects, but certain patients appear to be more at risk for experiencing them. These include people with diseased kidney function, liver disorders, hemophilia, and other blood clotting disorders, people who have a low number of clotting cells and platelets in their blood, hypertension, high blood pressure, vascular retinopathy, issues with blood vessels at the back of the eye, a history of bleeding in the lungs, and coughing up blood, undergo epidural anesthesia, that's spinal injections to numb pain common in childbirth, an indwelling catheter in their spine for pain relief after surgery. This is very serious conditions. Plus those being treated with medications that increase the risk of bleeding, such as NSAIDs, so non-steroidal anti-inflammatory drugs like ibuprofen, aspirin, etc. And remember, this is just a little bit of the list. In addition to those NSAID drugs like ibuprofen, aspirin, etc., there's also those being treated with selective serotonin reuptake inhibitor, or otherwise known as SSRI, antidepressants, and those being treated with antiplatelet medications. So the point, what's the point? I think it is clear where the danger lurks: pharmaceutical synthetic drugs. So let's look at something else that seems to be getting very, very common. You see these vapor clinics popping up all over the place. You notice how smoking got its bad rep because the truth was told. And over the years, most people have declined from that, but I'm seeing, especially in the younger people, that more and more are turning to these things called e-cigarettes. So this is your heart on e-cigarettes. Vapors, beware. Nicotine, formaldehyde, and other chemicals in e-cigarettes could not only damage your heart, some may also cause cancer. E-cigarettes are gaining in popularity, in part because they lack the dangerous smoke, tar, and carbon monoxide of traditional smokes. But could they still damage your heart? Yes. Health advocates around the world, from the American Heart Association to the World Health Organization, are calling for more strict e-cigarette regulations because of possible heart and lung health risk. In a study published in January 2015 in the New England Journal of Medicine, researchers found that the lifetime cancer risk of using e-cigarettes long-term is estimated to be 5 to 15 times higher than that of smoking a pack of cigarettes a day. Due to the toxic substance formaldehyde in the e-cigarette vapor, do they really know what they're getting into? Let's go to another quote. Dong quai, motherwort, and licorice may impair blood clotting. In people with heart disease who also take anticoagulant or antiplatelet drugs. Did you get that? It's not that it does in itself, it's for people who also take anticoagulant or antiplatelet drugs. These herbal products may also increase the risk of severe bleeding if taken with pharmaceuticals. That's the key, if taken with pharmaceuticals. Dong quai alone is used for enriching and nourishing the blood, meaning it increases the quality of blood. Women have used it after having a baby or PMS, menopause and cramps, constipation, psoriasis, anemia, ulcers, joint pain, and high blood pressure. Motherwort alone treats anxiety, flatulence, high blood pressure, hyperthyroidism, not hypo, insomnia, irregular heartbeat, arrhythmia, and menopause symptoms like hot flashes. Monkshood, also known as aconite, or wolf's bane, or leopard's bane, and devil's helmet, so it's got a lot of names, has been linked with sudden deaths. The toxins in the plant can cause death by dramatically slowing the heart rate, causing heart attacks. This poisonous plant used in traditional Chinese medicine reduces heart rate in order to compensate for a weakened heart muscle. But research shows it also increases the risk of lethal abnormal heart rhythms, a condition called ventricular tachycardia. Monkshood alone is used for pain reliever, labor pains, anti-inflammatory, anxiety, tension reliever, nervous system disorders, immune system booster, fever reducer, heart palpitations, sleep aid, and detoxifies the body. It is derived from a poisonous flower. So it does have a lot of good properties. Again, your highest risk is when you mix it with medications that have a similar effect on the body. Ginseng can increase your risk of low blood pressure shortly after use, particularly when you're taking medication to lower your blood pressure. Ginseng initially increases nitric oxide synthesis in the body, which would be healthy. But ironically, chronic use increases risk of high blood pressure. Ginseng can also lower the kidney's response to diuretic medications used to eliminate excess fluid from the body. Ginseng alone, both American ginseng and Asian ginseng, are believed to boost the energy and immune system, lower blood sugar and cholesterol levels, reduce stress, promote relaxation, and it's anti-inflammatory. It's also used to treat diabetes, helps brain function, helps in some cancers, plus manages ED in men. Licorice. Licorice raises the high blood pressure and fluid retention in elders and those on medications that are related. So medications related to these things, which increases the heart workload. Licorice root alone is used to soothe gastrointestinal problems in cases of blood poisoning, stomach ulcers, and heartburn. Licorice root extract can speed the repair of the stomach lining and restores balance, mainly due to the anti-inflammatory and immune-boosting properties. Lily of the Valley increases the risk of slow heart rate and electrical heart block, and is similar to the medication digitalis. Lily of the Valley can increase the risk of a severe slow heart rate when used with other drugs such as beta blockers and calcium channel blockers that also slow the heart rate. Lily of the Valley alone is used for heart problems including heart failure and irregular heartbeat, also for urinary tract infections, kidney stones, weak contractions in labor, epilepsy, fluid retention, edema, strokes, and resulting paralysis, eye infections, and even leprosy. Now here's another slight twist on words. Yohimbine, an extract from tree bark, is a pharmaceutical drug. It raises blood pressure by increasing the stress hormone norepinephrine, which can make the heart work harder and increase the risk of abnormal heart rhythms. Now, what's different, Yohimbe, not Yohimbine, Yohimbe is a natural herbal supplement found in stores, unlike the medical facsimile Yohimbine. It is used to treat erectile dysfunction and promote weight loss. The key way it works is through blocking alpha-2 adrenogenic receptors. I'm sharing this information not as an attack on dietary supplements, but to provide information on potential risk, which almost all are due to the combining with real culprit pharmaceuticals. Even though many of these are natural products, they have medicinal effects in the body, but not like pharmaceutical synthetic drugs. I always say herbs are like natural medicine, God's medicine, and great when used properly. And that do not include in itself side effects. They do not include in themselves side effects anything like the pharmaceuticals. Medical researchers search the jungles of the world for new plants, herbs, bark, insects, etc. that have potent medicinal benefits for mankind, but when they find one, they take it back to the lab and synthesize it and mass produce it. The result is a facsimile, not the real thing, a fake that includes many to light to serious and fatal side effects. Another sad point is that it does not produce the same benefits of its original natural model. I know you've seen plenty of commercials, and even though it might be for, I don't know, maybe you're depressed or you have high blood pressure or you got a hangnail or something's not right, and they're suggesting always with beautiful nature scenes and people smiling and happy that you take a particular pharmaceutical drug that they want you to go to your doctor and ask about. And among those lists, many times you'll see death as a risk of taking it. Also, I find that many times, whatever you're suffering from that you want to take the medication, sometimes the medication can increase that problem to a very critical stage. Stick with the real thing. Our advanced alternative testing here provides us large amount of detailed information to assess a person and their overall health, including cardiovascular system. Aside from our advanced live and dry cell dark field microscopy, we include Zyto customized testing, Many get confused thinking it's standard Zyto Elite test, but we use the program as a carrier for additional advanced programs that provide information that Zyto alone is simply not able to provide. Then there is over 30 years of working with very serious, critical, and rare disorders and diseases in natural, non-toxic ways that usually provides truly remarkable results. Some very basics about heart health. Then we need to plan our next lecture. So because there is so much important information still needed on this topic, we just like to take also time to provide more on the brain as well. So we're going to have another one on cardiovascular and another one on brain. So let's mention some basics here, very basics. Number one, it is so very vital to hydrate. Most people think they do, but they don't. Want a guideline? 1 ounce of water per pound of body weight daily. Things like coffee, carbonation, lemon and water, which so many people do, will cause you to need additional water daily. Don't eat, number two, don't eat too heavy of meals on a regular basis, especially fried foods, red meats, processed foods, and animal fats. Number three, take appropriate supplementation like basics, healthy vitamin C, not man-made ascorbic acid, mostly from GMO corn source, and mostly from China, no matter what the brand of vitamin C is. Number four, CoQ10 and ubiquinol appropriately in your daily diet. Those are excellent for the cardiovascular system and the heart muscle itself. Number five, exercise, and especially stretching exercise. If health allows, cardiovascular exercise at least 4 days a week. 1 or 2 days a week just doesn't get it. 3 days a week is borderline, 4 days or more. Number six, get tested to see what condition you were in, to take out the mystery and the guesswork. We have the Zyto Elite, but we mostly use the more advanced programs that have been integrated into the Zyto program to provide us with much more detailed testing and results. The same applied to the recovery protocols we use, which are in no way standard. We also use blood tests for those who are able to come to our office. Except for blood tests, we can offer this testing and recovery protocols wherever you live, if you have high-speed internet, a PC, and the rest can be accomplished. Number seven, TKM is obviously very important and has accomplished what other methods and medicines and therapies and supplements have not been able to accomplish. Cardiovascular disease is another so-called silent killer. It is like cancer. Everyone says they are so surprised to hear they have cancer, or a serious cardiovascular disease or impairment, or why there was a sudden heart attack or stroke. It is because they creep up on you. If you're alive and are not doing the appropriate things for your health and regularly test with accurate, detailed enough resources, which I'm not talking about just standardized testing. You don't want to ignore standardized testing, but you need something. In other words, how many times have you heard me in classes where somebody goes and gets a full cardiovascular test and work up on their health, and they walk out with 2 thumbs up, and sometimes that day or that week or 2 weeks can drop dead of a heart attack or have a major heart attack. So there's a lot more to learn and a lot more to find out. So the point being, don't be surprised. Get prepared. We have a lot of people that have had problems, and you are the one that decides if you're going to do something effective about it now. Just remember to not wait until something serious happens. Don't just think prevention and health, but take the action. God bless you and your family and your health.
Okay.
And here is a short commercial. So the phone app is out, tkmapp.com. What I would advise is you go now with your phone, just reach over and grab your phone, whether it's an iPhone or an Android. If it's iPhone, go to your app store. If it's an Android, go to the Play Store and download the app now. Let's get a couple of questions in here with another comment. So what can be done with this remote testing? We just had word this week from confirmation of someone we've known that knows TKM and has had classes, but called us and told us of a diagnosis from the medical doctor of cancer. Pretty severe. And so we started testing and working with them, and they never came into this office one time, but they were very rarely dedicated to doing what it takes and sticking to the protocol. And we just got word with them this week that confirmed that they're clear with cancer. On our testing and everything, it looked great, so we wanted them to go out and get some other testing that is quantitative to confirm it. It's always good to have confirming. You can have 2 confirmations, 3 more. If you want 10, that's fine. I don't see any problem in that. So what can be done? There's a lot that can be done. Do I prefer it be like that? No, because there's things missing when you're not here to where you can come and get some of the therapies and some of the other testing that we're able to do. But some great things have been accomplished. And cardiovascular disease, for our perspective and what we've been working with for several decades, is a piece of cake. Even severe situations and many other types of disorders related to the cardiovascular diseases that have been reversed when the medical community says is impossible. So things like holes in the heart, your infarction rate is so low they're wondering if you can survive the day, where you have close tie-ins with kidney disorder affecting heart. Lupus can also be involved. All these things have been reversed doing the appropriate right things. So just wanted to encourage people to check, not just check, oh, I feel good, I seem fine, my doctor says I'm doing great. How many people do you know that have said that and then afterwards have a problem and they were surprised? Because there's more thorough testing. Let me just mention one little example about standardized medical testing when it comes to something so common that everybody gets. There's no one outside of that. As you age, you get more and more narrowing of your vessels for different reasons. Let's just keep it simple. More and more narrowing. Have you ever heard anybody get testing from standardized medicine and come back and say, well, they told me I have 20% narrowing of my vessels, or 30%, or 40%, or 50%. Normally what you hear is most of the time it's 80 to 100%. Rarely you might hear, well, we found that you have about 75% blockage. Statistically, they say that their testing cannot determine when you have 50% or less blockage. So you could be half the ability to pump the blood through your body to have health and get a thumbs up from all the standardized medical testing. So you do need to do preventative things because we know that it is narrowing and the tests are not sufficient enough in standardized medicine to let you know what state you're really in. So there's other tests that we can do, and there's things that we can do as preventative before you get a heart condition. That's another thing I wanted to add is we are very sticklers when it comes to cancer. I know this is about heart disease. If you don't want to do the standard protocol for cancer and you've been diagnosed with a terminal cancer and you want to do something natural, you got to be very, very serious, because if you do the standard approach, you don't have to do much. They do it for you. They do the surgery for you. They do the radiation for you. They do the chemo for you. And you go live your life. And that day, if you're in a hospital, they will serve you Jell-O and desserts and high sodium and processed flour and processed foods and nitrates and everything else. Things that aggravate cancer and impair your immune system and work against you. Because they, the perpetual they that we're talking about, is just going to do those 3 procedures and see if they get it. So if they got it, great. But how many people do you know of that they go through those treatments and then they have a reoccurrence? That's why they say, on the average, every 3 months you need to come back in for a checkup. Why? Because the highest statistics are within a year you're going to have a reoccurrence of cancer. What falls in the category for the majority of all of them is at least within 5 years. But a lot of them it's within a year. So just don't mess with it. Do the right things. And what I'm saying about that comparison is most people have no idea what it takes. Even though I have that Cancer 1 and Cancer 2 videos out, what it really takes to address it the natural way. And addressing cancer the natural way doesn't mean that there's a guarantee that you're going to be healed and the cancer is going to be gone. What you're doing is you're trying to treat the cause and attack the cancer and deal with the health of the person so that you raise all the odds in their favor for them to survive. And if you don't put your ducks in a row, 1 or 2 things can take you out. There are people that choose a combination. Well, I want to do surgery and natural medicine. Or I want to do chemo and natural medicine. Or I want to do all of it in natural medicine. It's a case-per-case situation, depending on what the cancer is, where it is, how advanced it is, what your history is, if you've ever had it before, what surgeries you've had, to all explain about your risk. How toxic are you? How willing are you to radically change your diet and lifestyle? All these things need to be thought about and talked about before you make your choice. So I think we're good. God bless you, and we'll see you next time. So what was your question?
Question is about tofu, because I read somewhere about this, those people who are these hormone sensitive, then the eating too much of tofu can create problems.
Absolutely, absolutely.
So even a little bit can create problems?
Well, here's the deal. If you're not of Asian blood, you should not have it, period. Your body doesn't process it right. If you do decide, tofu greatly messes with your hormones.
Right.
You don't want to escalate your hormones with even after cancer. Let's say you've had it, and by whatever way they say it's clear, you're done. Don't mess with your hormones. People who do things in food or supplements or vitamins and herbs, who take things that can influence your hormones, have a much higher risk of getting cancer back quick. It's not worth it. You just don't do it.
Okay. So it seems that for generations, I mean, what the family has been eating, if one is from the Asian origin or coming from a vegetarian family, so the previous generation never have eaten meat, then even the meat is not probably good for them. Or takes longer to digest.
Because it slows the digestion system, makes the body work harder, makes the kidneys work harder, makes so many other systems work harder. That's not a wise thing to do.
Right.
Now, there are things you get out of red meat when you're a strong, healthy person. But eating it in excess is bad across the board. I also find just people that are heavy meat eaters are typically a lot more stiff, carry a lot more tension and stress in their body. They're not near as agile.